keep communicating, we keep learning, and that's how we're going to master this whole pandemic, is just being smarter than it has been. So I welcome you to another Facebook Live, and we have another very outstanding panel of speakers that are going to be with us tonight to talk to us and then answer those questions that we just can't seem to find the answers for. So I'm going to start with our first speaker. Dr. Brian Sherman specializes in critical care medicine and family medicine. He is the chair of critical medicine at Torrance Memorial. He attended medical school at the University of Autónoma de Guadalajara School of Medicine. He completed his residency at Santa Barbara Cottage Hospital and his fellowship at Mount Sinai Medical Center. Please welcome Dr. Sherman.
Well, good evening, everybody. It's great to be here. It's wonderful that we can have this discussion and have some fun, too. I think that's what's important. I think this is a very exciting time. I think we're on the cusp of big breakthroughs. We are an incredible, resilient species. We've been through so much, all of us and all of our ancestors together, and there's so much to look forward to. This is actually a very positive time. So I'm going to start talking about variants. And what is a variant? You know, I kind of think about that often because I have twins at home. And they're not identical, they're fraternal, they kind of look alike, but one's a variant of the other. Kind of some of the same genetics, you know, but one kind of came out slightly different. One has some advantages of speed, the other one has some advantages of maybe having a little better balance. So let's talk about variants. So first of all, you have a virus, all right? And if you can see, you know, my slide up here, that is a big map of variants. There are variants all over the place. Viruses are constantly producing variants. The coronavirus has been making mutations and producing variants ever since the beginning, before it even became news, and we know that other viruses do this too. So, really quick, let's talk just about across the spectrum and why we're speaking about this. A lot of people are concerned because if you look at the slide, you have some asymptomatic, pre-symptomatic stage. Then you have mild illness, which everybody's heard about, kind of mild symptoms of fever, cough, loss of taste and smell. Moderate illness, that you're having a little bit trouble getting oxygen in and your oxygen saturations are down. Now it's in your lower respiratory tract. Severe illness, where you're having some severe symptoms, really having some shortness of breath. Maybe you have some of the other symptoms too, fever and chills and stomach cramps and some of the other things. But the one thing that starts to get people into the hospital, of course, is having difficulty breathing. And of course, there's, you know, severe and critical illness, and those are the patients that we see, are the small percentage of patients that we see in the ICU, okay? The majority never make it to the ICU. That's a good thing. And the exciting time right now is why we're talking about it now is we have several vaccines all over the world now that are working for us. And that's a historic time where we actually have vaccines going on at the same time as variants going on. So the next slide is understanding the age group. Like 0 to 4, there's very a small population that gets the coronavirus and gets sick. But if you take a look at 18 to 49, these are your typically working, strong individuals that are providing services for our society. And that's the largest one in the middle, and that's where most of our illness is, and you can see it actually comes down. So, a variant is not a new virus. Let's first be clear on that. This is the original virus that's making changes, okay? There's subtle changes. Sometimes you'll hear the variant called the wild type. So these are subtle changes that can be advantageous for the virus to survive. There is an evolution going on in these viruses, or it can be disadvantage. There can be a disadvantage, or it can be disadvantageous to the virus. You can have the virus make a mutation and cause a variant that actually implodes on itself and it stops it from working. No one talks about that, but that's a possibility that the virus can burn itself out by making a mutation that doesn't work for itself. So the idea is that the mechanisms of a variant, there's some proteins changing. Most people watching this may not be involved directly in science, but many of you and all of us actually live in science. Everything that we do, everything we've created, all steams from science and how things are made and built and understanding things. And so we're trying to understand this. So the mechanism of the variant is one change of the variant. Now this virus changes, as you can see, can increase the fitness or viral shedding or make it longer. A virus can say, hey, instead of I can infect people within a week, 5, 10 days, well, I'm going to be better and more transmissible, so now I can infect people over 2 or 3 weeks. That's one of the things we worry about. The other thing is, fancy word, increased receptor binding. The thing's easier to attach in your body and make you infected, okay? We're susceptible to these protein changes, okay? How about the strength of this new variant, this virus that's changed a little bit? Hey, now, theoretically, it can live a little longer in certain temperatures. It's a little hardier, although we haven't seen very little, if any, transmission, on fomites, which is a fancy word for my remote at home. But, theoretically, the virus could change to be a little hardier in the environment. Okay, and then the other thing is there's always this mutation I talked about that actually the virus can't fix itself and it makes a mutation and that virus dies. This is just a quick map from Next Strain, and I want to thank all of the people from Next Strain, the FDA, CDC, public and private labs, as well as our own pharmacy department here and researchers that have helped put a lot of this information together. So you can see there's a list of some of the common variants. Now, I suggest with variants is to think of them from the country of origin. Because if you start getting into these numbers, it's going to make any of our heads spin. So the virus mutates because there's random changes in the genome. 1 to 2 mutations per month. Sometimes that means nothing. We've had mutations go on since this has been known. Okay? The UK virus had a lot of mutations in the spike protein. Now that spike protein is where we're focused on our vaccines. That's where it gets into your bodies, starts getting into your cells, starts replicating. So, hey, why not block that spike protein, make it so it doesn't work, okay? But a few mutations make a difference, and the more mutations that happen, of course, helps the virus live and spread. I always think about it as if I was a virus and I could mutate. Well, I think I would want to be stronger, thinner, faster, healthier, and so I'm going to try to mutate my body so that I can run 50 miles an hour, so that I can live longer. So that's what the virus wants to do. So South African, similar virus, but it has 2 more mutations than the UK. The Brazilian then has 2 more mutations than that. You're going to hear all these crazy numbers you see on the slide. 501V1, 501YV2, LR, and 405, and you're going to hear all these numbers. Don't pay attention to those because I'm not a genome expert. I'm a bedside doctor, okay? I need to know, hey, this is what the virus is called. This is where it originated. Okay, I got it. That's all I need to know. And I can understand it and track it on websites, in the public, and on the news, and know what people are talking about. Okay, here's a quick slide to give you an idea. So that spike protein I talked about, you can see there's number of spike changes on the UK variant, 8, South African variant, there's another couple of changes there. So maybe the first one's a little, has mutated into something a little stronger, and then the next one, and then you see the Brazil with 12, and then you see those fancy numbers on the left I told you about. Much easier just to say, hey, United, the UK variant, okay? So, in reality, these things we're studying, we're looking at the variants, we're looking at our vaccines that we'll be talking about here very shortly that can block the effectiveness of the virus. The virus is smart. These variants mutate. They want to try to get around different things. They want to try to get around the virus, the vaccination. They want to try to get around monoclonal antibodies. You notice I said the word mono. That means one. But right now it's exciting because of all these vaccines are working. They're working. People are not getting severe illness. That's what we care about. Not getting severe illness. If I get a cold from the common coronavirus, or this ends up that the vaccine, all these vaccines we know are working, and maybe I get a variant and I get a cold because I have some immunity, fine, I can deal with a cold, some mild symptoms. But these vaccines, knowing about the variants, and what we're learning is that they keep people from getting severely and critically ill and out of the hospital, right? That's what we care about. Most people actually probably take sick days when they're well, and they come to work when they're sick. Anyway, okay, this is a fancy picture I don't want anybody to get lost in. These are spike proteins. These are spike proteins, and I have cited in my references from the studies that these came from, but to give you an example, all those areas in red are mutations on the spike protein. Don't get lost in it. It looks like maybe a piece of gum someone stuck on the wall, but nonetheless, at least you can say you've seen it. All right, variants of concern. We talked about the UK, the B117, the South African, the B1351. We have the P1 from Brazil, and there's been a few other ones. And really what it comes down to is, where are all of these variants? And there are probably a lot of places we don't know because we just have been starting to get programs underway with universities, public and government labs to sequence where all of these are, okay? So you'll hear more about these, so don't be afraid. You will hear more, and that's okay. But know that the programs that this great world has started with vaccines is winning. Once again, if you look at all this map of the variants, you see that orange one up there, and it's like, wow, how come it's so densely clustered? Well, that's a variant that's starting to reproduce and becoming more proliferant in society. That's what happens. This thing starts building speed, and the variant starts going from person to person and becomes more virulent, and it's more prevalent in your community, so you know it's there. And we see that happen fast. That's when we worry about these and start picking them up. Anyway, this is another busy slide I'm going to skip, but it kind of tells you, if you look at on the left side of that slide, it says colorations. And if you look down, it kind of describes like what makes this mutation of these variants special. Transmissible, it's evasive, is it more transmissible? These are things that we worry about. Does a mutation, does this variant that's kind of changed to be stronger or better, is it easier to get? Is it more infective? Does it evade our immune system? That's where the studies are, and that's what we're looking at. Here again, you can see the frequency from September through January, and you notice that orange part on the bottom, that fancy number 501YV1. That's one of the common new variants, and you can see how it's growing. Here's that world map again. But guess what? The world map's also getting vaccinated. So these are just different, showing you where these different variants are. And it's hard to show on this map, but each different color represents a different variant. These are now, and to go in slowly into vaccines, and my colleagues will be speaking about this, is there's expected vaccine effectiveness And there is vaccines and monoclonal antibodies, as you'll hear going forward. If you look at the left of the slide, you see the vaccines that you've heard about on the news. Everybody's excited about Johnson & Johnson. I believe they'll be meeting tomorrow on that. AstraZeneca is still going on, and you'll hear more about them coming up in the weeks to come. And of course, most people have been getting the Pfizer and the Moderna. You see the B117 UK, effective, effective, effective. If you look at these other variants, the South African and the Brazil, it doesn't say zero effectiveness, okay? These things are effective. These things are very effective. On any given year, you could say the flu is 40 to 60% effective. This messenger RNA, this new vaccine technology is incredible. You need to feel safe and positive. It's incredible, okay? And if I personally feel that if these things, what we know keeps people out of the hospital in severe illness, I can deal with all of the mild to moderate illnesses I've had through my whole life, okay? I've had the flu, all right? I've had chicken pox, okay? I've had these different, like everybody else, I'm as human. So if I can have all of these mild illnesses, and sometimes moderate, that's fine. I stay home, I get over them. These vaccines work. So don't get hung up on reduced, and don't get hung up on percentages, okay? The biggest thing about society is keeping people healthy and alive and out of the hospital, and that's what this is doing. Here you can see we're ramping up doses of vaccines from manufacturers. The Moderna is in orange, the Pfizer's in blue, the cumulative, and you see, and this was as of late January, and this continues to increase. This is the key. This is what it's about. So when I talk about variants, I want you to understand that there's some main variants that we've gone over, okay? And maybe I'll just go back. So you have the UK, the South African, and the Brazil, and then there's this little USA variant, L452R. I'm sure we'll come up with a number, but we know that's been a variant, and there's been a local to California. We think that caused some of our increased patients in Southern California and Northern California, but nonetheless, these are out there. You'll hear about them on the news, and you've already heard, but I would not be fearful. I want to just show this as what we'll go into the vaccine program here, is that there's so many surveillance programs now, okay? And there is the vaccine adverse event reporting systems. There's VSafe. Many of you have gotten your vaccine. You'll get a text if you signed up on VSafe asking, hey, how you're feeling? How are you doing? How's your day? Do you want coffee? Not yet. Not that yet, but I wish. Can I deliver? So Genesis up there is a program with all of, is a largest program in the country that handles all nursing homes and collects data from nursing homes. They have their own database. The VA has a database, the Department of Defense. So we've got all these tracking databases to track how you're doing, how the vaccines are doing. And this is unprecedented ever in the history of our species. So I feel good. I want you to feel good. I want you to say, yeah, we've gone through a tough time. The generations before us throughout the world have gone through tough times, but we are smart, and we're moving forward, and there is light. So thank you very much.
Dr. Sherman, thank you very much. I think that is something that we all needed to hear because all we've heard is negative, 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 and we stop looking at the fact that we're figuring this thing out. And one of these days, it's going to be just like polio and all of the other things that we've conquered in our history. So our next two speakers are both very well experienced pharmacists, and they're going to take on the vaccine part of our program this evening. Vinay Yakkundi is currently the lead emergency department pharmacist at the Torrance Memorial Hospital and has been a practicing clinical pharmacist for 12 years. Sharing the stage with them will be Susan Lieu, who is also a pharmacist and has been at Torrance Memorial for 18 years. She works in many areas of the hospital, including critical care, med-surg, and outpatient pharmacy. She's actively participating in the COVID vaccine clinics and is excited to share her knowledge with you today. I'm going to take a moment and just do a little busy work. For the sake of our Facebook audience, we need to speak into the microphone. So welcome, pharmacists.
Okay, thank you, everyone. I'm going to be talking first. My name is Vinay Yakkundi. Like they mentioned, I'm mostly primarily working in the emergency department, and I'm just going to talk to you a little bit about some of the vaccines and so a little bit of information about those. So before I get started with talking about the vaccines, these are just some numbers in terms of how many cases that we've seen and how many deaths. As you can see here, as of this week, in Los Angeles County, we've had close to 1.2 million cases of COVID-19 and close to a little bit under 20,000 deaths. Throughout the state of California, we've had about 3.5 million cases as well, and just a little bit under 50,000 deaths due to the COVID-19. However, the good news is in the past few weeks, the numbers have been gradually declining. We're hopeful that with the aggressive vaccination programs that we will be, and as well people continuing to wear masks, social distance, as well, that we will be seeing these numbers continue to decline as well. Just a little bit of information. Our Torrance Memorial Hospital is as well seeing these numbers go down as well here. So just wanted to talk a little bit about some of the current treatments that we have available. If you look on the slide, we see I'll talk first about some of the inpatient treatments that we use. One of the important treatments that we use is corticosteroids for our patients, especially those who are in the ICU. And as well, one treatment you may have heard about on the news a lot because it was one of the very first treatments that we had last year for the COVID-19 virus was remdesivir. So that primarily helps to block the virus from an enzyme that helps the virus replicate in the body. So this medication helps to block the virus from replicating. So it was one of the very first treatments that was approved by the FDA that helped us kind of initially start to get a handle on this virus. As well, we have like some other treatment options that are available. We use high flow oxygen as well as proning, which means normally when we think of hospitalized patients, we think of them lying on their back in the hospital. So proning is turning them into another position. We'll put them on their stomach. So that's been shown as well to help with these patients. And as well, we use what's called convalescent plasma. This was made a little bit more popular at the end of last year when former President Trump was treated with it as well. So this is another treatment option. And another important point to make is these patients, especially the ones who are with COVID-19 in the hospital, are at a higher risk for severe blood clots. So we want to usually treat them more aggressively for anticoagulation or what's known as making their blood thinner. So these are some medications that we use, heparin or Lovenox, and another category of drugs is called direct 10A inhibitors, usually commonly known with brand names such as you may have heard of, such as Eliquis or Xarelto. And we also use common drug warfarin as well for patients who can take these oral medications. We do have some outpatient monoclonal antibody treatments. These are just approved for outpatient use. Currently at Torrance Memorial, we're not using these monoclonal antibodies, but they are there as well. So if you do hear about them, these are other treatments that are being used to help treat the patients. And there are some other supportive care measures, such as vitamin D, zinc, and ascorbic acid, commonly known as vitamin C. So there's three main types of vaccines that we use here. The ones that are right now, the Pfizer and the Moderna ones are, like my colleague Dr. Sherman had mentioned, are the mRNA vaccines. I'll talk in one of the upcoming slides a little bit more in detail about how those work. And I know some people have, because this is a new technology, some people have concerns about them. But I'll try to hopefully allay some of those concerns with my explanation. So other type of vaccines are, it's called like a protein subunit vaccines, where basically harmless parts of the virus are basically injected, and your immune system is basically going to learn how to defend itself against the coronavirus. So these are just harmless pieces of the virus that won't cause you to have severe COVID-type symptoms, but basically we're wanting to teach your immune system to develop antibodies, develop T cells specific for the virus, so that way if you are exposed to the virus after you've gotten this vaccine, your body will be able to quickly mount an immune response, neutralize it before you develop any of the severe symptoms that can cause patients to go into the hospital or may even cause death for patients. Finally, we have the last one on the far right here is what's called vector vaccines. So the vector vaccines are basically an inactivated harmless virus, which basically will act as like a vector or kind of a carrier, is going to carry the harmless protein subunits into your body, and similar to the one I just mentioned, it's going to basically help your body, again, develop an immune response similarly, and help develop the antibodies and the T cells. So currently, like I mentioned, the Pfizer and the Moderna one are usually based on this mRNA technology, which is something fairly new that's being used right now, and I'll talk in one of the upcoming slides about how it's been really effective so far for this virus. And currently, there's some other vaccines that are currently in development. The Johnson & Johnson one, as well as the AstraZeneca one, are kind of based more on this vector technology. So I talked a little bit about some of the vaccines. The ones you've probably most heard of, or many of you may have even received already if you're in the eligible category, is the Pfizer as well as the Moderna vaccines. The Johnson & Johnson vaccine was recently recommended by one of the FDA subcommittees, and we're hopeful that very shortly, in the next few days, that it may be granted emergency use authorization by the FDA. One of the big benefits with the Johnson & Johnson vaccine compared to the Pfizer or the Moderna vaccine is that it's a single-shot vaccine. So those of you who may have received the vaccine understand the Pfizer and Moderna ones. You have to take one vaccine, wait 3 weeks, and then get your second shot. Big benefit with the Johnson & Johnson one is it's a single shot, and it's shown 85% effectiveness in reducing severe disease, preventing hospitalization. The AstraZeneca one is still pending emergency use authorization. It's been used a little bit in some European countries, but it's also been proven to be very, very effective against this coronavirus. So I'm going to talk a little bit about the mRNA vaccines. Like I mentioned, this is a very new technology that we're using, especially for the Pfizer and for the Moderna vaccines. So what does mRNA mean? It means messenger RNA. So basically how this works is the vaccine is delivering a message to your cells. It's teaching them how to make what's called a spike protein. So it's basically teaching how to make a protein that's common to the COVID-19 virus. So why is this important? Once your immune system recognizes that, it'll learn exactly what kind of antibodies it needs to make specific for that. This happens for many other viral infections, that your body makes specific antibodies, T cells, specific for a certain type of virus. So this is very important because it'll help teach your immune system, so that way if you are exposed after you've received your vaccination, your body will be able to quickly neutralize the virus without you developing the severe symptoms of COVID-19. So do these vaccines work? When the vaccines were announced at late 2020, one of the very good news about it was that they were shown to be 94 to 95% effective. Many vaccines may only have 50, 60, or sometimes 70%, but having 95% efficacy was very good news, especially against disease that has caused such a pandemic all over the world. So, and important point to note is that even with the trials that were done for these vaccines, normally trials for vaccines may take several years. This one was done within almost less than a year. However, it's important to note that none of the safety measures were compromised. It still went through all the same rigorous trials. Usually there's 3 phases of clinical trials for a drug or vaccine. Went through all phase 1, 2, and 3 with thousands of volunteers all over the world. And it was found to be efficacious in all of those across all genders, age groups, as well as ethnicities and socioeconomic groups. So there's a lot of common myths about the vaccines, or you may have heard about from friends or read about in the news. So one of the important things to note is that this vaccine does not contain a live COVID virus. So when you are getting a vaccine, you're not being injected with the COVID virus. Some people have been worried that, oh, if I'm getting a live virus injected into me. There are some vaccines that do work that way. However, with the COVID vaccine, like I mentioned, the ones that are currently available as well as the upcoming ones, none of those are live viruses that you're being injected with. And another common fear is that many of these mRNA, this new technology, many people have a fear, oh, it's going to change my genes or change my genetics, my DNA. None of these are going to. Like I mentioned, I kind of showed you how these mRNA vaccines work. They don't change your genes or DNA in any way, shape, or form. So there's nothing to fear that these will alter your genetics, change your genes in any way. And then finally, it's also important to remember, even after you've been vaccinated, you still need to wear your mask when you're outside, social distance, as well as wash your hands frequently, because although these vaccines are very efficacious, it's still important to maintain these measures because it hasn't been rolled out to everyone. We haven't established what we call herd immunity, where a large percentage of the population has been vaccinated against COVID-19. And there is still a chance that even those who have received the full dose of the vaccination could still potentially spread it. So as we're still learning a lot about this virus and how these vaccines work. So it's still important to continue these same measures that we've been doing for almost the past year. Okay, and next my colleague Susan is going to be talking a little bit about some of the specifics here at Torrance Memorial.
Good evening, everyone. Thank you for joining us today. I'm going to go over some details about what Torrance Memorial has been doing for the vaccination clinics. Our journey began in November 2020 for the COVID-19 vaccine planning, and our efforts have been ongoing. We have people on calls daily with the county. Oh, let me take off my mask. Excuse me. I'm so used to wearing them. It's important, right? Okay, so we've had people on phone calls daily with the county to get the most updated information. We have a team that's been trying to get as many vaccines as possible so that we can give it to our community. Currently, we have given over 14,000 vaccinations, mostly to healthcare workers. 71% of our staff, physicians, and volunteers have been vaccinated currently. We get the common question of whether or not we're going to have future vaccine clinics at Torrance Memorial. And if we could have vaccines clinics every day so that we can vaccinate everyone that's eligible, we would be all over it. But our hands are tied. The vaccine supply is extremely limited. We have no control over how much the county gives to us. And since the shipments are so limited and unpredictable, Torrance Memorial will only hold vaccine clinics as supplies become available. We are currently not pre-registering anyone, nor do we have a waiting list for future clinics. We do have a COVID-19 hotline where you can call to get updated information. The phone number is 310-784-6824. Okay. Due to the unpredictability of the supply of vaccine, we recommend visiting the LA County Department of Health website to find alternative vaccine clinics. Do not wait for Torrance Memorial to have a clinic if you are able to get an appointment somewhere else. It's more important that you get a vaccine as soon as possible. So two websites you can go to find available appointments. The first one's the Los Angeles County Department of Public Health. The second one is the California Department of Public Health, myturn.ca.gov. These websites will give you information on who is eligible for a vaccine and what documentation you should bring to the appointment. They will show you available vaccination appointments at megapods, pharmacies, health clinics, or hospitals. And all vaccinations are by appointment only. Due to the limited number of supply and recent weather situations, such as the snowstorm, which delayed shipment of vaccines, we recognize that it has been difficult for some people to find an appointment. Although this is very frustrating, in this instance, persistence will pay off. New clinics are being added all the time, so you just need to keep trying, okay? For those with disabilities or no computer access, you can call 833-540-0473 between the hours of 8 a.m. and 8:30 p.m., 7 days a week, and someone can try to help you find an appointment. Okay, so who can get vaccinated now? This slide shows the vaccination phase for Los Angeles County. So it's important to point out that some cities, such as Long Beach and Pasadena, have their own health departments, and they may be in other phases or tiers. For example, Long Beach right now is vaccinating teachers, but in Los Angeles, other parts of Los Angeles, we're not at that stage yet. So to be eligible to go to those sites in Pasadena or Long Beach, you need to show proof of residency or employment. The rest of the cities in Los Angeles will follow the phases for the recommendation for the Los Angeles County guidelines. Currently, we're vaccinating healthcare workers, long-term care residents, and those people in skilled nursing facilities, and individuals over 65. Starting in March, hopefully on March 1st, there's going to be a new sector, 3 new sectors of people who would be eligible for vaccinations. That includes agriculture and food, so those are grocery store workers and restaurant workers. Education and childcare people, so teachers, faculty, and staff at schools and universities, and the emergency services people, the EMS people, firefighters, and law enforcement. So further down the line, people who would be able to get vaccines include vaccinating those people who are at higher risk. So at the discretion of healthcare providers and using their clinical judgment, they may vaccinate individuals 16 to 64 who are deemed to get very sick from COVID-19 because they have the following severe health conditions. This includes people with cancer, currently with a weakened immune system, people with chronic kidney disease, stage 4 or above, chronic pulmonary disease in which they are oxygen dependent, Down syndrome patients, solid organ transplant that leads to a weakened immune system, pregnancy, sickle cell disease, heart conditions such as heart failure, coronary artery disease, or cardiomyopathies, severe obesity with a BMI greater than 40, type 2 diabetes with hemoglobin A1C greater than 7.5, or if as a result of a developmental or severe high-risk disability, one of the more of the following applies. If the individual is likely to develop severe life-threatening illness or disease from COVID-19 infection, acquiring COVID-19 will limit the individual's ability to receive ongoing care or services vital to their well-being and survival, or providing adequate and timely COVID care will be particularly challenging as a result of the individual's disability. So we're hoping maybe mid-March, we would be able to vaccinate this group of people. What to expect when you get vaccinated. So the Pfizer and Moderna vaccines are given as 2 shots in your upper arm, 3 to 4 weeks apart. And then it typically takes about 2 weeks after the second shot for sufficient immunity to kick in. Even after you're vaccinated, we keep repeating this, you still might be able to pick up the virus. So it's important that you wear a mask, keep social distancing, and take preventive measures to make sure that everyone is safe. Some common side effects from receiving the vaccine include pain and swelling in your arm. You could use a cool compress at the injection site to help reduce the pain and discomfort. And also moving your arm and exercising it might help with that too. Other side effects include fever, chills, fatigue, and headache. Taking some Tylenol and drinking plenty of fluids may help with these problems. The good news about side effects is that it's showing that your body is building immunity and protecting itself. The side effects may feel like the flu and may even affect your daily activities, but they should go away after a few days. So in most cases, the discomfort caused by fever and pain is normal. In the following situations, you may need to contact your doctor or healthcare provider. If the injection site becomes red or tender after 24 hours, or if the side effects are worrying or do not seem to go away after a few days. If you get a COVID-19 vaccine and then you think you might be having a severe allergic reaction, such as shortness of breath or difficulty breathing, and this is after you leave the vaccination site, then you should call 911 immediately. So about your second shot, both mRNA vaccines require 2 injections, the Pfizer and the Moderna. So Pfizer requires a second shot 21 days later, and Moderna requires one 28 days later. It's been recently updated that suggesting that your second dose should be given as close to the recommended interval as possible. However, if that is not feasible, then the second dose may be administered up to 42 days after the first dose. Some people may be experiencing some delays in their second shot because of the snowstorms or shipments of vaccines. If you haven't heard back about your second shot by the 21st or 28th day, then you can go back to your original site and bring your immunization card with you. They should be able to give you your shot then. So to end, the combination of getting a vaccine, wearing a mask, and maintaining social distancing will help us reduce the chance of contracting the virus and spreading it to others. You need to protect yourself so that you can protect those around you. Together, we can fight COVID-19 and help end this pandemic, and that's our ultimate goal, right? Thank you.
All right, I know I'm a little delayed on this, but I am Dr. Mary Beth Miller, and I'm the moderator for this evening. So you've got to hear the panel give us some information. We now are going to try to conquer all of the questions. We've got some questions that have already come in, and if you'd like to add some other questions to the conversation, there is the chat box. So I'm going to start immediately with our next set of questions. When should I seek emergency medical attention? Susan?
Anything that's causing you shortness of breath, difficulty breathing, or if you feel swelling in your throat, on your tongue, any palpitate, like abnormal heart rate or a drop in blood pressure should be signs that you should seek immediate medical attention.
All right, our next question. Will these variants respond to medicines currently being used to treat people for COVID-19? How about you, Dr. Sherman?
At this time, yes. The question is, which we will see evidence coming up is how well. But right now, I'm sorry. So the answer is yes. And where people get hung up is on the percentages with each variant. So once again, like I said, there was the original parent virus, and there has been some mutations that have happened. So currently, what we understand is they will be effective against these variants. Now, the virus has gotten smarter. Now, does that mean that it is as effective? No, but long as what we know, it's keeping people from severe and critical illness, yes, is the answer to that.
All right. Can I get vaccinated while having COVID-19? Vinay?
Okay. So yeah, if you're currently sick with the COVID-19, you should wait until you've recovered before getting your vaccine. The current CDC guidelines recommend that usually wait at least 10 days after you've recovered before going to get the vaccine. So that way you don't infect healthcare workers working at these different sites when you go to get vaccinated. So usually waiting 10 days until after your symptoms have resolved before going to seek vaccination.
Now, I'm going to follow this up with a little bit of a follow-up question because I think people have been getting confused on these answers. If I was treated with COVID-19 with monoclonal antibodies or convalescent plasma, how long should I wait before getting the COVID vaccine? Vinay?
Oh, okay. So yeah, based on the current guidelines that we have, you should usually with the convalescent plasma, or if you've received the antibody treatment, it's usually recommended to wait at least 90 days after you've received the treatment before seeking to get the vaccine. So that's about 3 months. Usually you want to wait before going to get your vaccine, assuming you are eligible for it.
And I wanted to space those questions that way because in my clinics, I come across all the kinds of questions that we're going to cover tonight, and that's been a common theme. I've been told I have to wait 90 days after I've had COVID, and that's just the misinformation that gets started out there. Now you guys know the real information. Should I get a vaccine if I get anaphylaxis from iodine contrast with the CT or have food allergies? Susan?
Luckily, there aren't any big contraindications to getting the vaccine. The iodine allergy is not a contraindication, but if you did experience anaphylaxis, then you would let your vaccination site know, and they would monitor you for 30 minutes versus the 15-minute observation period, just to make sure you don't experience any side effects. And food allergies also aren't contraindications. It's severe anaphylactic type reactions that we would monitor, spend a little bit more time monitoring you for after the shot.
As I counsel patients on this question, I like to look at what their past vaccine history has been. If they've had a number of vaccines and never had a problem, I don't really care how big their food allergy or their med allergy list is. So that's one of the things that you can look at as you make your own decisions. Thank you for holding this event. I have an 88 and 82-year-old living with me who are quite concerned about vaccine availability. For my 88-year-old, he is unable to travel to any of the county sites. What advice do you have for us, as he does not belong to a medical group which yet has the vaccine available? The anxiety is causing mental health issues. Do you foresee mass availability in Torrance at any point? I realize this is conjecture. Thank you for what you're doing. Susan?
I understand the frustration of trying to get an appointment. Like I said before, persistence in trying to get a site will pay off. Our community pharmacies are also administering vaccines. The Costco and Torrance, I know, have been giving COVID-19 vaccines. And as we get more vaccines available, and if Johnson & Johnson becomes available soon too, that's a single shot, hopefully more appointments and sites will be available.
All right. Do you have any ideas about when the surgery room will be open and under what conditions will it open? Vinay?
So right now, Torrance Memorial has resumed all inpatient and outpatient surgeries, as well as other elective procedures that were postponed due to COVID-19. I know during the end of 2020, as well as beginning of this year, we had some delay of those or cancellation of those due to a surge in patients that we had in the hospital. However, if you have had to delay medical care or had a procedure postponed, please make sure to call to reschedule or to make an appointment to see your physician, as many of these have resumed, as, like I mentioned before, some of the COVID numbers have thankfully been trending down in the right direction.
How long does protection from a COVID-19 vaccine last? Vinay?
Okay, so currently, right now, it's not known exactly how long this protection will last. I mean, we're hopeful that it'll last for a long time, especially as we're rolling this vaccine out. And as well, it's not known as well, patients who have been infected with it and recovered, how long that immunity lasts. It's still currently being studied, but that's why we're being aggressive with trying to have patients receive the vaccine as soon as they are eligible.
What would you say to someone who is nervous about or reluctant about getting the vaccine? What if I feel it is not safe or would harm me? And I'm going to ask each of the panelists to answer this one. Vinay?
Oh, okay. Okay, so yeah, like I mentioned, probably the thing I would say is make sure, assuming you are eligible, it's definitely much safer to get the vaccine versus getting infected with COVID-19. We've seen so many people, although there has been a high recovery rate, but there are so many people who do end up going into the hospital, going into the ICU, may have to be intubated, which is having a tube put in their throat to help them breathe, and many people have died from this this epidemic, this plague that has gone on for almost a year now. So the biggest thing I would say is, assuming you meet the criteria, you don't have a history of severe allergies, and you are able to take the vaccine, getting the vaccine is one of the single most important things that you can do once you are eligible for this. And I would say, I think the biggest thing to prevent harm is just make sure you have all the information. We've tried to present some of that information here, so that way you are aware of, so you do have all this information, so you feel more confident in if you want to get this vaccine.
Susan?
I would say I would trust the science. People have been researching this for a while. The mRNA vaccine technology is not brand new. It just seems new because it's the first time we've seen it. In the United States alone, over 66 million doses of the vaccines have been administered. So, it is out there in the world, and people are not getting severe illness from it, which is fantastic. And like Vinay said, the biggest thing is getting educated, getting information. I know every person's situation can be unique, so if you need to talk to your doctor about it to discuss pros and cons, then that's just something you have to do so that you feel comfortable getting the vaccine.
And Dr. Sherman?
Hi again. So, the first thing that we have to address is, why are you afraid? And really look at why you're afraid and what are the obstacles to clearing that fear up and making fear become knowledge. That's what's important. So the first thing is, people are afraid of the side effects. Is the side effects going to be so severe that it makes me sick? So number one, the side effects are mild, and with the millions of people that have been vaccinated already, if there was some big travesty, you would have heard about it already, okay? I'm not saying that you can't get muscle soreness or an arm sore or a little bit of chills or fatigue. That's great. That means your body is reacting to this vaccine. So those are expected. So expected side effects of your body revving up is not something you should be fearful. Number two, will it mutate in me? Is this going to change who I am? Am I going to grow another arm? No. So the messenger RNA, as my colleague pointed out, this does not incorporate into your own genetics and cause you to have a genetic mistake or alter you in any genetic way, okay? And we even know that even viruses that are DNA double-stranded, like adenovirus, those do not get incorporated in our DNA either of ourselves, that are actually live viruses that are a DNA versus an RNA. So this vaccine is not going to get incorporated into you and change who you are. So that's another fear point. I think the other thing is that a lot of people don't realize that why this technology is safe is it had been studied for at least 10 years, even before this, even before coronavirus. But traditionally, it's been so expensive to make this. It's been well studied, but it hadn't made prime time. This is actually not as new as you think. It's new for the public, but it's been well studied for at least 10 years, even before coronavirus hit the scene. So to reiterate, do not be afraid of the side effects. Be afraid of the virus. Be afraid of having severe symptoms with the virus. Symptoms that can kill you if if you're unlucky enough to be one of those people. That's what you should say, I don't want that. And be understanding that the vaccine is safe, and we've had millions and millions of people that have done this safely and have come before you, and it's going to be okay.
Thank you, panel. Those are all excellent answers. Are vaccinated patients, or vaccinated people safe to socialize with other vaccinated people? Vinay?
Okay, so currently it's still recommended. Sorry. Sir, it's currently still recommended that you still, even though you may, let's say you may have received both the doses of your vaccine, and as well other people outside your household may have received theirs, it's still recommended to still continue to maintain the same behaviors we have been, because there is still a small chance that you could transmit this virus to other people, or you could still become infected. But it's very important that we still continue those same behaviors, because we've still only slowly been starting to roll out the vaccine. So continue wearing your mask when you go outside, hand washing frequently, as well as maintaining social distancing, because like I said, there is still some small chance that it could still be transmitted to others.
All right, there are rumors that if I take pain meds or other meds after getting the vaccine, that it stops the vaccine from working. Is this true? And this is open.
I can take that.
Okay.
So that's a great, great question. So first of all, we don't have evidence to say one way or the other. But with science, what we feel is that to allow your body to form a reaction to this vaccine, so you develop antibodies, and then knock this virus down, allow yourself to feel some of these. And only if it's extreme and really bothers you, then you could take some pain relief like Tylenol, something in that manner to make you feel better. But right now the recommendation, the general recommendation, and I have to say we don't have a lot of evidence on it, but what we know about the immune system is to let your body get revved up, let your body react to that, and if it becomes uncomfortable, then you could give yourself some of the over-the-counter medications that you would normally do.
We hear a lot about masking and hand washing. Do we still need to wash off our groceries and wipe down high-touch surfaces? And I'll leave these open to whoever wants to take them.
Okay. So, fortunately, we have not seen a lot of transmitting from something to here and getting people sick. Is it possible? Sure. If I was ill and I sneezed on this or coughed on it and I had a lot of viral load and I give it to somebody else and they drink it, yes. I've made this transmissible by putting something on there. The chances of that are very low, but the fact that it is still possible, and especially when people are ill and actually shedding virus, at that time, that's why it's good to have good behaviors. Just like you would with the flu and flu season, or any other diseases, if you happen to have a cruise and you've been on a cruise and gotten some cruise ship dysentery, then yes, it's still good to wash your hands and not touch your face. But as far as groceries and letting your food sit outside for 10 days while it spoils and bringing it inside, that's not necessary, okay? But it's always good to have it to wash your hands, but I wouldn't wipe down those bags, I wouldn't wipe down that food. I would do what you normally do, but just be good hygiene, washing your hands and just being clean. Because, hey, the bags have been dirty anyway. So just common sense, okay?
And I like that answer. I know in my own behaviors, I've just gotten so much better that the minute I get home from whatever I was doing, I wash my hands because I don't know what I was exposed to. Not because I expected to, but you know, you just never know what's out there. So it doesn't even have to be COVID. What phase will pregnant women be in, and what phase will pregnant women be in, and is it safe for me to get a vaccine while pregnant or breastfeeding?
So pregnancy is on that list of, if you didn't meet any of the other criteria of being a healthcare worker or anything like that, pregnancy would be on the list of high-risk individuals, age 16 to 64, that could get a vaccine. The American College of Obstetricians and Gynecologists recommend pregnant women receive the vaccine, but a conversation between the patient and a clinical team may help the patient decide, based on the risk of catching COVID and the potential effects of getting sick, whether or not getting the vaccine would be a good decision at that time. And lactating moms, they are able to get vaccines also, and that is a recommendation. But of course, it's up to each individual, and it's not going to be forced on anyone.
I have just an added source of information for that. So if you go to the CDC website, there's an area where you will see that we're monitoring women with pregnancy that have started since the beginning of the vaccine process. I believe the last count, I know there was over 15,000. So there should be more data coming out on that outside of, you know, what we spoke about here, but please go to the CDC website and you start to see more data come out on that.
And just to piggyback on that, all of us just have to realize we're all in the same boat. We're all learning. But what I'm amazed at is how fast our learning curve has been, how much we've actually been able to do in less than a year. So just imagine how much more we're going to know by this time next year. Will there be annual booster shots? How long will I be protected after I get both shots?
I think I mentioned a little bit when I had answered one of the questions. Currently, we don't know exactly how long the immunity is going to last. It's possible that there may be some booster shots based on some of the variants Dr. Sherman talked about. However, important thing to note is that these vaccines so far have shown very good efficacy against even these different variants that have been discovered. So is it possible that there could be a booster shot later on? Yes, it's possible. But as of right now, these vaccines, like I mentioned during my talk, are very, very effective against, they've shown over like 94 to 95% efficacy against the different types of the COVID-19 virus as well.
Any other thoughts?
Sure. So, once again, we are learning on the fly. This is us at our best as humans, and as these companies have put out these vaccines, they are working on understanding and studying the variants, these slight mutations of the original virus, and looking at those now. So it's possible there could be a booster shot in the future, and if that happens, that's okay too, because most of us get a flu shot every year. So we'll have to see more data as it comes out, but the great news is they're on it and actively looking at this.
Why are flu cases so low? Whoever wants to.
Okay, so think about, this is the greatest question, and I really appreciate this question. It's exciting to me. I wish you could see the excitement through my mask that came with the suit. So the bottom line is that it proves that washing, gelling, the mask works. I can tell you as a critical care physician, every flu season, even before coronavirus, I'm wearing this and I'm washing my hands when I go into a room with somebody with the flu, because I don't want to get it. So where's the flu? The flu is being quietly hiding in a corner somewhere because we've been washing our hands and we've been wearing masks. That's my answer.
Is COVID going to be here forever? When can we get back to normal? Anybody? Yes, is it going to be here forever, or will we get back to normal?
Well, that's a good question. I don't even know if I was normal before coronavirus, but in reality, so there's a couple of things here. Is one, everything we're talking about tonight, there's two things. There's the research that happens in the labs. There's the research, the clinical trials that happen with patients. And then there's real life. And real life is us going about our business every day, living our lives and dealing with the stress and the fears of trying to live. And so with the vaccine programs that have come on, and with these safety measures that have helped keep the flu at bay, we will start to move towards a more regular life. I'm not saying it's going to happen overnight. These things take time. The flu that happened in the early 1900s took 3 years to get over. For currently, you can expect this to be our lives to get better every month as more people around the world get vaccinated. And you'll know as you start to see the news come out. So I would say it's going to take a little bit of time. And with towards the end of this year, you'll see it much better, and even into the next year. But it's going to take a little bit of time, but we're heading in the right direction.
I encourage everyone to make some diary entries this year, because in 5 years, this is all going to be a distant memory, and you'll want to look back and remember how afraid we were. Thanks for watching. A recording of this video will be available on our Facebook page and will be uploaded to our website tomorrow at torranceMemorial.org/MOL. For the most up-to-date information on COVID-19 and vaccine availability, visit torranceMemorial.org/COVID-19. I'd like to just close with a couple of comments. We're all afraid because this vaccine is new and it's never been done before. But to echo what's already been said, the mRNA science has been worked on for 25 years at least, probably most of the work in the last 10 years, because we've had the technology and more information just about how genetics work. We have a genomic understanding that we have never had. We had the whole genome of this virus within a few weeks of it showing up in the world. That's never been done before. We just are so much more technologically savvy, and we know what we need to know and get that information first. This was a worldwide effort. We are a worldwide community, so we were able to come up with a vaccine because we had so many volunteers from everywhere willing to volunteer and do that part of the clinical studies that needed to get done. We got them done faster than ever even possible before. We had money being thrown at this from everywhere, and we all know economics drives things faster and harder than almost anything. So there's a lot of fear about this vaccine, but they really shouldn't be, because this is probably the best developed vaccine we've ever had, just because we've had the skill, the understanding, and the technology. Then the last closing point is we all want to get back to normal. We are sick and tired of this. And one of the best ways to get back to normal is to vaccinate. And that's been proven for as many years as we've been vaccinating our kids. We've been getting flu shots, because we all understand when we as a society vaccinate, we help everybody else. So don't be afraid. Be powerful and say, you know what, COVID, your days are numbered. Good night, everybody.